all of you, and welcome to the University of Cape Town's Pesticide Network Discussion Forum. I'm Professor Andrea Rother. I'm head of the Environmental Health Division at the University of Cape Town in South Africa, who is facilitating and hosting this discussion forum with funding from Sweden through the Swedish Chemicals Agency. There'll also be Dr. Natasha Lalou in the background, who will be making sure that we have a smooth running discussion today. If you're not familiar with the discussion forum, it's really a community of practice around pesticides. And what we try and do with this community of practice is to bring together people from different regions, from different sectors, different stakeholder groups, to really have a conversation around different issues to do with pesticides. And particularly, we're trying to build the capacity of regulators, researchers, NGOs in low and middle income countries, and to have these opportunities to discuss emerging issues related to pesticide use. And of course, today we have an important discussion looking at a guidance document that's been developed, but particularly around preventing suicide from using pesticides. It's very important these guidance documents are developed. Many important guidance documents are developed by the United Nations, this one by FAO and WHO, and yet often many people aren't aware of them or aren't aware how to implement them. So we're hoping that today's discussion will really stimulate and encourage you to look at the document if you haven't already, and to work out how to use it within your different organizations. And just to remind you, or if you're new, that this is not a webinar, rather it will be a chat discussion. So we encourage you to speak in the chat by typing. And if you have questions, could you please put them in the Q&A? You can direct them to a particular person if you like. It just makes it easier to identify them rather than posting it in the chat. And depending on how active we are today, I may allow some of the participants to speak to hear your experience with using the guidance document. So we'll have 3 presenters today. We'll have 3 questions, and there will be polls that will be posted, and we encourage you to fill them in. So again, welcome, and please introduce yourself in the chat with your name, organization, and country. And we will now move on to our presenters. So today's topic I mentioned is understanding and implementing this guidance document that has been developed. And we have 3 esteemed speakers who will be taking us through the discussion. So we have Dr. Phumi Bandara from the World Health Organization, Dr. Cindy Stephen, who's going to give us some statistics from the Poison Information Center at the Red Cross Children's Hospital here in Cape Town, South Africa, and Debbie Muir, who's from the Department of Forestry, Fisheries and Environment, the government department in South Africa. So welcome to all 3 of you, and thank you for giving of your time today. And Phumi, I'll move on to you. So we'll go on to the next slide.
Sure. I think I'm sharing.
To you. Oh, right. You're going to be sharing. That's correct.
Yeah.
Okay. Thank you.
Okay. Can I just confirm you can see my screen?
We can see your screen, and they are in presenter mode. Thank you.
Perfect. Okay, well, firstly, I have to say thank you, Andrea and Natasha, for inviting me to this forum. As Andrea mentioned, I am within the WHO headquarters. I specifically work as a consultant on suicide prevention within the Department of Mental Health and Substance Use. And by background, I'm an epidemiologist, and my research primarily focuses on suicide and self-harm in low and middle income countries. So I come at this with very much a mental health focus, and it's really nice to see. I think in the chat I've seen so far some representation from agriculture and environment across the world. So it's a good opportunity for these 2 sectors to cross over. Because the audience appears to me to be more on the agricultural and environment side, I think it's worth me just going over some of the facts around suicide that we know. So according to estimates from the WHO, over 720,000 people die by suicide every year. Suicide does not discriminate. It occurs across all age groups. And it's the third leading cause of death among 15 to 29-year-olds. So it's a really key issue among young people. Suicide occurs across all regions of the world, but the vast majority of suicides actually occur in low and middle income countries, 73%. And this is not just an indicator of population numbers, but suicide rates are also very high in these regions of the world. And for every suicide that occurs, there are likely to be more than 20 suicide attempts. Some of the common myths surrounding suicide, I think, are really important to address. And one frequently asked question that pops up, or a myth that comes up, is that if someone is thinking about suicide, are they determined to die? So essentially, if someone is suicidal or has suicidal thoughts, will they use any means necessary to end their life? And the answer to this is no. People who are suicidal are often very ambivalent about living or dying, and often it's to provide relief from an acute moment of distress. So someone may act very impulsively by drinking, for example, pesticides, and die a few days later, even though they would have liked to have lived. And this comes through if you speak to medical doctors or ER physicians. I have spoken to doctors from Sri Lanka, from Fiji, Suriname, and they all tell me the same thing, that they have had patients come in, often young people, who have ingested pesticide as a means of self-harm. But they regret that action, and often the doctors, they can't do anything about it. It's too late, and there is no antidote. There's also no clear evidence that individuals will substitute or switch to another method if you take one away. So in response, the WHO or the UN have put together a specific goal to address suicide. So within the UN Sustainable Development Goals, there is an indicator to reduce the suicide rates by 1/3 by 2030. And actually, this is the only indicator for mental health. Unfortunately, although there has been decline since 2015 when the SDGs were put together, at the rate that we're currently at, we will not be able to reach this reduction by 1/3 in countries by 2030. In response to meeting this goal, the WHO have put together a series of interventions, or a suite called Live Life. This is the package of interventions to address suicide. But one that I want to really highlight for the purpose of this discussion is limiting access to the means of suicide. This is, among all of the 4 key interventions that have been identified, has the strongest evidence base for reducing suicides at a population level. It's been demonstrated over several decades that if you restrict access to highly lethal methods of suicide, significant reductions can be made in the suicide rate within countries. And if we think about reaching that global target of 1/3 reduction, and thinking about some of the methods that are used for suicide worldwide, we know that pesticides, or highly hazardous pesticides, are among the most common means of suicide worldwide. Actually, it's estimated that 20%, or 1 in 5 suicides, are attributable to pesticide self-poisoning. So this is a huge number. It's equivalent to roughly 140,000 lives each year. So if we are able to address pesticide-related suicides, we can considerably reduce the global suicides. Some characteristics of pesticide-related suicides, often referred to as fatal self-poisoning or fatal pesticide self-poisoning, many of these acts of self-harm or self-poisoning are typically carried out, as I mentioned, impulsively with little premeditation or preparation. Many of these acts have low suicidal intent. Of course, there are some that have high suicidal intent, but the vast majority have low suicidal intent, especially those acts of self-harm that are performed by young people. And we know this because there was a study that was conducted in Sri Lanka, which looked at the time period between taking a poison, between contemplating suicide and taking that poison. And what they found is that the time period is very short, estimated to be around 30 minutes. So what this suggests is a really high degree of impulsivity around the act. The case fatality of poisoning is lower in high-income countries where young people tend to take prescription medicine or medicinal substances rather than pesticides, for example, in low and middle-income countries. And we know that the prescription medicine has a much lower case fatality than, say, a highly hazardous pesticide. And the purpose of self-harm is often to communicate. So most don't have the wish to die. They are experiencing an acute moment of distress. They may not have the avenues for support. And so because these lethal methods of self-harm are readily available, they end up dying, unfortunately, because of the lethal substance ingested. I want to highlight this study here, which showed that where bans were implemented, so when highly hazardous pesticides were removed, particularly those ones that were used for self-poisoning, the most dramatic impact was made among young people. So this is just the age group, and you can see these are young females, a significant drop after the implementation of bans. I'm not going to spend too much time on this. I think I have 10 minutes, but I think I have a few minutes left. Is that right, Andrea?
You could go ahead. Oops. Okay. Sorry, you can go ahead and keep, I think what you're covering is really important. So please go ahead. Yeah.
Okay.
Thank you.
So this next study was really pivotal. These next studies were really pivotal in informing WHO recommendations for suicide prevention, particularly implementing national bans on highly hazardous pesticides. So what we saw in Sri Lanka is that after a progressive implementation of bans on highly hazardous pesticides that were used for self-poisoning, there was a 70% reduction in the overall suicide rate following this implementation of bans over a period of 20 years. And this is equivalent, they estimated, of 93,000 lives saved. And what's really important about this study is that it was not just a reduction in pesticide-related suicides, but this drove down the overall, the total suicides as well within the population. So just these bans were able to contribute into a significant reduction in the overall suicide rate. And this was also replicated in the Republic of Korea, where a ban on paraquat was implemented, and it resulted in significant reductions in the suicides by pesticides, which also drove down the overall suicide rate. Following these studies, the WHO officially identified restricting access to acutely toxic pesticides as an evidence-based intervention to prevent suicide. And guidance documents have been produced, specifically one around preventing suicide, targeting pesticide registrars and regulators. And a cost effectiveness study, an economic evaluation, was also conducted. And this study found that national bans on pesticides used for self-poisoning is a highly cost-effective intervention for suicide, particularly in countries where there is a high proportion of suicides attributable to pesticide self-poisoning. I think I'm going to stop here because I think we're going to go through the guidance in the next session. but I'm happy to throw to questions now.
Great, thank you. I mean, that was really important and so clear and succinct, the information that you provided, and really starting out with an understanding about suicide and then moving into, the role that pesticides are playing. I'm hoping we will get our PowerPoints back so that we can then move on to the question. Please do post any questions that you may have in the Q&A. We are now going to move on to Dr. Stephen, who is going to give us some statistics. Cindy, do you want to turn on your video? And there you are. Welcome again, and over to you.
Thanks so much, Andrea. It's good to be with everybody, and thank you, Pumi. That was really great input. Thank you. So the question that I've been asked to, or the answer, the situation to share with you today is about the situation in South Africa, and particularly the data that we've collected as the Poison Information Helpline. So for those who on this call who perhaps don't have the background of what a Poison Information Center is, I'll briefly describe it. So a Poison Center is a unit which particularly advises on and assists with the prevention, diagnosis, and the management of poisoning from any means. So we're going to be looking at the pesticides particularly, but we need to be able to advise on all means of poisoning for whatever reason and circumstance. And this is a picture of our Poison Center. One of my colleagues is on the phone. Certainly in South Africa, we provide a clinical advice service. It has been 24/7 until very recently, but I'll talk about that. And we're staffed by a small staff, 3 or 4 or 5 specialists in poisons information. We have an office, a telephone, 24-hour access, and poisoning resources that we develop. So thank you. Can I go to the next slide? So the next slide is to show the distribution of poison centers globally. And you will see clearly that there are some areas in the world where there are many poison centers, and of course some that there are not. And Africa is a glaring glaring hole in the sense that there are very few poison centers in Africa, about 11 in total. So there are many, many countries in Africa that don't have access to a poison center at all. If we can just click on the next click, please, Natasha. You can see in South Africa, we have 3 poison centers, 2 in Cape Town and 1 in Bloemfontein. So I'm from the Red Cross Children's Hospital Poison Center, and we work in our helpline service with our colleagues at the Tygerberg Poison Center. So if we can just go to the next slide, I'll quickly outline that collaboration so that you know where the data that I'm going to share with you is coming from. So both our poison centers at Red Cross Children's Hospital and at Tygerberg have been going for many years. We have different areas of expertise, but the one area that we did duplicate as such was the helpline or the telephone advice service. And so in 2015, we joined that together, which has been really good in many ways. And one really positive outcome of this is that we now have a really good database of cases that are reported to us. Now, you need to bear in mind when I share the data in the next slide that people call us voluntarily, so it's not mandatory that for every poisoning case you need to call the poison center or the poison helpline. So bear in mind that the data I show you will be partial. There'll be many, many patients also seen at our health facilities in South Africa that we don't know about. So with that background, can we have a quick look at the data slides? Thank you. So this is the first slide. If you look on the left, I've just looked over the last 3 years, 22, 23, 24. Each of those colored lines represents a different year, and the months are in the x-axis at the bottom. And you can see that there's a kind of a cyclical variation, which is seen worldwide with poison helpline services. But on average, we get over 1,000, 1,100 calls every month. In terms of who calls us, that bar chart on the right-hand part of the slide shows the different provinces in South Africa. So there are 9 provinces. You might not be able to see their acronyms at the bottom there, but there are the 9 provinces. The 3 tallest bars are the 3 most populous provinces. And you'll also see that the bar is divided into blue and orange, and that reflects who calls us. So we have many, many calls from doctors. Probably 2/3 of our calls are from doctors primarily, but other health workers as well. And about 1/3 come from the public. And then there are 2 other little things on the slide I want to alert you to. One is the alert, which is something that has really caused us quite considerable distress. We have been running as a 24-hour service for 40 years, but because of austerity and financial constraints, since July, we've had to close our service. So kind of after midnight from 1:30 in the morning until 8:30, there is no one to answer any poisoning queries. We're hoping that that won't be a permanent closure, but that's the reality we're in at the moment. And then the other thing is the lovely magnet at the bottom that Prof. Rother's department helped to put together to show how poison centers interface also within public health. And there's an example of a mom and a child who in fact has taken a pesticide and some basic guidance on what to do. Okay, thanks, Natasha. Can I go to the next slide just to look now at pesticide self-poisoning particularly. And I've looked here at the last 5 years of complete data that we have. And just at the pesticide related cases. So that bar chart with the blue chart bars looks at the last 5 years, and the blue bars reflect the total number of pesticide cases that we've been called about. And the orange line is the proportion that were related to self-poisoning. And it's always remarkable to me that 42% of all our pesticide cases are people who have taken a pesticide in association with emotional distress and self-poisoning. And of those cases, 3/4 are symptomatic. In fact, 6% have had life-threatening symptoms, and we had 13 deaths in this period. And really, paraquat, understandably, as we know how toxic it is, came through as the most common cause of death. Organophosphates are also there. There were 3 deaths from organophosphate, 1 from phosphine gas, so aluminium or zinc phosphide, 1 from MSMA, and 1 was unidentified. And you can see in that little table at the bottom, we classify all our cases according to severity. And so that's just the data behind the severity that I've described to you now. Thank you. Let's go on to the last slide, looking at a bit more information in terms of these patients. I could have got more out, but I wanted to be fairly brief. Particularly of note is that 21%, again, in keeping with what Pumi was saying, 21% are teenagers, and our teenage group is just 13 to 19 years. So I'm sure some of the other young adults are in that big 77% of adults group. And perhaps even more alarmingly in our setting is that 2% were children 12 years and under. And if we look at the kind of pesticide that was implicated in these self-poisoning cases, it always strikes us that almost 1/3 were in fact unidentified, which speaks to one of the issues with regulation and highly hazardous pesticides that I think is quite common in low and middle income countries, where pesticides are either imported illegally, unregistered, or they get decanted and sold in areas of informal housing where pests are a real problem. And so many times we actually don't know exactly what was the pesticide that caused particular illness. That said, about 1/4 were cholinergic, so the organophosphates and the carbamates. About 20%, 1/5 were anticoagulants. Those classically in our setting produce less acute illness. And then almost 10% were pyrethroids. So that was just a very, very brief overview of pesticide self-poisoning and the data that we have available from South Africa. So thank you very much. I'm very happy for any questions I can answer in the chat. Thanks, Andrea.
Thank you very much, Cindy. It's always good to have a case study and to see what is happening in a country. And, you know, our statistics are possibly quite underreported, but we do have statistics, which is important. So we're going to move to the first question, which is, to what extent is pesticide suicide a problem in your country? And I'd ask you to respond to this in the chat. In the meantime, I will allow for one question. So Kabishanga, we will give you the mic, but I ask you to make your question quick, please. Natasha, can Kabishanga speak?
I've allowed him to talk, so or them to talk. Kabishanga, you can unmute.
Okay, please. Good afternoon. Can you hear me?
Yes, loud and clear. Please go ahead.
Yeah. Now the issue of you are talking to Kabishanga. I work with New Horizons Women's Educational Center. Is an NGO in Uganda. I want to talk about the issue of self-poisoning. You see, the challenges comes that when the farmers, I myself am a farmer, we grow crops. But now the challenge side comes from the issue of the emerging, the pests and the diseases, the issues of drought, the issues of climate change, the issues of global warming. There is no way today that you can tell farmers not to use the pesticides. It is very difficult. Because as I talk now, there are pesticides like the 2,4-D and the weed master. They control the weed. They control the emerging pests and diseases. And where you apply those pesticides, you found that the crops are more good and they don't have any weed. So it's very difficult to challenge from the farmers because a farmer who would wish to produce.
Thank you. You're breaking up, Kabishanga, so we're actually going to just mute you for now, but we've got the point of what you're trying to say. And I think...
Okay.
Thank you very much. And I think what's important was the point that Pumi made, that it's not about banning all pesticides. It's banning the highly hazardous ones that are going to actually kill people who don't necessarily want to take their life. So it's all about really looking at the select few of highly hazardous pesticides, and that there are alternatives. And from what Pumi was showing, that there isn't an impact on agriculture by removing these pesticides, that agricultural production still continues. So I think the point that was being made is not to remove all pesticides. Sorry, Pumi, I'm responding. Perhaps you want to come in for that.
Yeah, I would just echo what you're saying exactly. It's WHO certainly does not, or the FAO certainly does not recommend banning all pesticides. It is, as Andrea just said, a small number of highly hazardous pesticides. And of course, it depends on the country. What you're saying is completely valid, that, you know, there are emerging risks with drought and climate change. And of course, these need to be considered. And these recommendations for any ban is definitely not immediate, of course. It's progressive over time with understanding the local situation, understanding what safer alternatives are available, what safer practices are available, and the capacity to implement those practices as well before any ban is even considered.
We also have a question in the Q&A, and I'm not sure if you would like to answer that or if Cindy would like to answer that. So it's from Anelia. I have seen so many unregistered insecticides and others in even well-known shops, and the shop owners aren't aware, or that is what I'm told. How do we stop this from happening? I'm not sure if the question's understood. Pumi or Cindy, do you want to try and respond to that?
I'm happy to try and respond. I mean, I just to agree with that. I think that many shop owners are not aware that of the toxicity of some of the things that they're selling. I'm not sure. I mean, obviously, how we solve that is by having better regulation, which is part of what we're going to be discussing today, and how we can then make sure that our good regulation is implemented and monitored. But just to agree with you, absolutely, that I think there are many very harmful pesticides that are sold without ill intent, because people are just not aware of the actual degree of toxicity of what they're selling.
Thanks for that. There's another question in the chat, and just to say, if you do have a question, do post it in the Q&A. We do find it a bit quicker, and please do continue to post your responses on the polls that you can see on the screen. So the second question is from Tom, who I think this might be for you, Cindy, who said there's interesting data. To what extent are the anticoagulants used in suicide attempts? And with South Africa just having banned all CMR anticoagulant rodenticides, it's concerning that there might be a further switch. Is it concerning that there might be a further switch to HHPs?
Yeah, no, so from the data that we have, about a fifth, so just under 20% of all self-poisoning patients do use the anticoagulants. I wasn't aware of a ban of all CMR anticoagulant rodenticides. So perhaps we could just clarify that. But I guess absolutely, if part of the reason that people use pesticides is they use what is readily available to them, then presumably if the less harmful, acutely harmful pesticides like the anticoagulants are no longer available and others remain available, there could well be a switch to more serious HHPs.
Yeah. Thanks for that. And I see that Debbie has actually responded to Tom saying that not all were banned, only 5 were banned and 4 were derogated, sorry. So let's just have a look at the first poll quickly. If you go back, Natasha, this is a very nice word cloud. So what pesticide active ingredients are commonly used for self-harm in your country, with organophosphates being the highest, aldocarb, which is a carbamate, being listed as well. And then if we go to the second slide, we asked you the question about poison information centers, and at the moment, there are some of you who say you have them, 3, but not functioning well. Then there are 4 who indicated no, there are no plans for setting up one, and then 4 who were saying yes, there are plans to set up. We'll go on to the next poll. And Debbie, perhaps you can respond to Tom's question about, there you are, thank you. So the last poll we have is mortuary data being used in your country for regulating pesticides linked to fatalities. As Cindy was illustrating, sometimes it's very difficult, particularly when street pesticides are used, to know whether which pesticide was actually causing the fatality, whereas with mortuary data, it's a bit more, can be a bit more specific if there's toxicological analysis done on the stomach contents. Cindy, do you want to say anything else about mortuary data? Cindy, I don't know if you want to say anything else about mortuary data.
Sorry. I was just trying to get to my mic.
I know the feeling.
Yeah. I'm not expert in that. I mean, we work with our forensic toxicology colleagues, and certainly they are very important in collating and collecting that pesticide mortuary data. So the other thing that we have in South Africa, and it would be interesting to know if it's the case elsewhere in the world, is that pesticide poisoning is a notifiable medical condition. So we are meant to, by law in our country, all health workers, and this would be forensic toxicologists as well, to report and notify any patient who is either symptomatic or who dies from pesticide poisoning. So we're really trying to strengthen that process in South Africa. It is there, it's been there for some years, but very poorly adhered to. And so in that way, the forensic data becomes also very, very important, because they often can test which active ingredient was involved and report as such. So they are a very important group. Thank you.
Thanks. And you can see from the screen that only 3 are aware that it's being used in their country. So we're going to move on now to the second question and second part. And Phumi, we're going to go back to you. Are you going to use your slides again?
No, I think this time Natasha is going to share.
Great.
Yeah.
Thank you. Then over to you.
Okay, so I'm just going to go through the guidance on the use of pesticide regulation to prevent suicide. I really need to acknowledge Professor Michael Edelston, who led the drafting of this document. He couldn't make it today, so I'm presenting on his behalf, and he's much more familiar with the document, but I will do my best to go through it. Next slide, please. Okay, so this is an overview of the chapters that are included in the document. So the first couple of sections, section 1, 2, 3, I have really already gone through in my initial presentation: suicides, risk factors, suicide by pesticide poisoning. The role of national authorities, I will go through that. I will just highlight that in the next slide, but just for one moment, monitoring and evaluation, I will go through that. And then the most important section, I guess, for this discussion is section 5 and 6, which is looking at different ways to implement regulation to prevent pesticide-related suicides. And I will go through each of these sections, but not in too much detail. Okay, next slide. Okay, this is a bit out of order, but that's all right. Okay, so I think we've kind of touched on this with the mortuary data, but the guidance talks about monitoring and evaluation of pesticide-related suicides and the importance of that, of course, in order to advocate for pesticide regulators to advocate for restricting or limiting access to highly hazardous pesticides that are used in self-poisoning. We need the data. Unfortunately, as we also saw from the Mentimeter responses, this data isn't always available. Often there might be data on the number of pesticides self-poisoning according to an international classification of diseases code, intentional self-poisoning, but very rarely it's the actual pesticide brand name is captured. And so there are various data sources where information on pesticide self-poisoning could come from. For example, death registration data. If a country has a national civil registration and vital statistics system, any death by pesticide self-poisoning should officially be registered. And often, because it's a case of self-harm and it comes under the category of self-injury, these cases are often also got an additional level of investigation involving the police, forensic pathologists. So additional detail can be found within these reports. Another source of data is hospitals. So hospital presenting cases of self-poisoning. The challenge with this data is that often what we find is that self-poisoning is reported, but not specifically the pesticide brand or product or active ingredient. And of course, mortuary data is also a key source of information where it's available. Next slide. Okay, so this section talks about the role of national authorities in preventing suicide. It highlights the necessary collaboration across national health, agricultural, and environmental authorities in order to make progress on preventing pesticide-related suicides. Of course, as I've just mentioned, a lot of the data on pesticide self-poisoning will come from the health sector. And so there's a collaboration is essentially needed across health and agricultural authorities. The guidance actually covers several articles of the Code of Conduct on pesticide management and recommends that these articles are represented and incorporated in national policy legislation for both health authorities and agricultural authorities. I'm not going to go through all of the articles because there's quite a few, but the key message is that no single sector can really tackle this issue on its own. The health data is critical for surveillance, and agriculture is critical, obviously, for the regulation aspect. So it's an ongoing feedback loop. This figure is actually taken from a brochure that was produced after the guidance document was published. And this brochure is like a concise summary of the guidance document, which is much more comprehensive. And in that brochure, it has this figure that shows all the key stakeholders that should be considered in phasing out the use of highly hazardous pesticides that are used in acts of self-poisoning. And of course, it lists health and agricultural and environmental agencies, but also other actors like border control and custom authorities, to control if there's leaky borders and pesticides being illegally crossing across borders. Pesticide producers, importers, exporters, the media will be critical in increasing awareness about new laws. The end users, local agricultural leaders, farmers, of course, pesticide regulators and registrars, very critical, and poison centers, forensic laboratories, mortuaries, health facilities, and academia as well. Next slide, please. Okay, so sorry for the busy slide, but no need to read the text. It was just to highlight what I just mentioned earlier, that this brochure is really a summary of one of the key recommendations or key sections of the guidance document, which is around phasing out, like section 5.3, phasing out acutely toxic, highly hazardous pesticides. This brochure provides kind of like a step-by-step guidance on what to do. So in green, you see in bold, identifying the pesticides that are used for suicide. So we're not talking about phasing out all pesticides, but only those ones that are really resulting in a considerable number of deaths within the country. Determining the availability of safer alternatives, promotion and distribution of less harmful alternatives and practices, the removal or phase out of identified acutely toxic, highly hazardous pesticides, ensuring that there is appropriate inspection and control of the use of highly hazardous pesticides, and ongoing surveillance of pesticide poisoning. So this brochure is publicly available. Next slide, please. Okay, so just to acknowledge that these slides I borrowed from Professor Michael Edelston. So the next section is highlighting another approach to regulation to prevent pesticide-related suicides, and these are restricting and reformulating pesticide formulations. This can be an effective approach in preventing suicide in some situations. So in the guidance document, they provide some examples. 3 gram 56% aluminium phosphide tablets from the market in India in the 90s, while permitting 12 grams, 15% tablets and 6% tablets. This resulted in a marked reduction in the case fatality and a subsequent reduction in suicides from this poison. In Sri Lanka, they permitted only a 3% wettable powder of carbofuran, which also resulted in a lower case fatality and a slight reduction as well. But what I also want to highlight is that although there are some instances of a reduction in case fatality, as in this case in Sri Lanka, the fatality dropped from around 73% to 63%. So while that is a drop, it's not a huge drop. So people are still dying as a result. So yeah, these approaches can be effective in some situations, but not necessarily as dramatic an impact as phasing out a highly hazardous pesticide completely. Next slide, please. Okay, so this slide is showing other approaches to regulation for preventing pesticide-related suicide. So one other approach is restricting the use of highly hazardous pesticides to professional sprayers or to particular crops. So this is about restricting its use. But what happens here is that the responsibility is really placed on the farmers themselves, and it really requires effective enforcement. So regulators, it's really important that they should consider national enforcement capacity before adopting it, because there is evidence that the approach does not always work. We have examples from Sri Lanka and India that indicate that pesticides, when pesticides are restricted to the sprayers, they can still eventually end up into homes and then used for self-poisoning. So it's really important that national authorities consider the capacity for enforcement when considering this approach. 5.6, improving storage and reducing leftover pesticides. So this is about careful storage or safe storage of pesticides to limit their availability to non-authorized users. The issue with this, particularly with pesticide self-poisoning, is that there has been studies that have shown that the effectiveness is limited. So an example of this, and you can see this in the figure represented, a large cluster randomized trial of the effectiveness of providing safe storage boxes or lockable boxes, which was essentially a huge container, and they delivered this to over 53,000 households in a province of Sri Lanka. And what they found is there was actually no difference in the incidence of pesticide self-poisoning over the 3 years of follow-up. So that's what you're seeing in the chart. So it didn't really show effectiveness in reducing pesticide self-poisoning. Engineering controls. This is about, again, putting the onus on farmers, particularly for personal protective equipment. The latter, so having safer gear and PPE, is not really relevant for self-poisoning. It's designed to prevent occupational poisoning of pesticide sprayers rather than self-poisoning. So if pesticide self-poisoning is a huge issue in your country, then this would have very little impact. And of course, 5.8, we've discussed this already. I think the importance of raising awareness, particularly among both health and agricultural sectors, of the issue of pesticide-related suicides, but also amongst farmers as well, in order to get buy-in, local communities, civil society, clinicians in rural hospitals to make sure that they're collecting the right data, mortuaries, forensic departments, and the private sector, of course. It's really important to engage. Can I move to the next slide? Okay, so the final section is on alternative approaches to crop protection. So the Code of Conduct recommends that governments make a concerted effort to develop and promote the use of integrated pest management. Apologies, I cannot comment too much on this. This is beyond my expertise. But according to the guidance document, agroecological practices were recommended by the 4th International Conference on Chemicals and by FAO. These methods will reduce or substitute the use of acutely toxic HHPs or highly hazardous pesticides in agriculture, thus reducing their availability in rural communities. And the conclusion of the guidance document is, again, the power and the use of regulation to prevent suicides from pesticides can really meaningfully improve health and prevent lives lost, but also have benefit for the environment through the use of through the reduced use of certain pesticides and greater reliance on agroecological practices. So I will stop there and open up for questions or hand over to the next presenter.
Thank you, Pumi. Thank you very much for that and for giving a good overview of the guidance document. There is a question about the guidance document, which I'll come to shortly, but just I really think to emphasize the importance of the hierarchy of control of exposure and source and access to pesticides. And it was really important how you highlighted, the PPE is not relevant for suicide and really starting at the top of the hierarchy of control with elimination and then working your way down maybe to engineering controls. So one of the questions is from Leston from Malawi asking, how can we implement the guidance document in countries? It's a big question for you.
Yes, that's a big question. So I think as was highlighted in the document, it's one of the key aspects of it is multi-sectoral collaboration. This is not the responsibility of one individual or one department, but a collective effort between health, agricultural, and, if relevant, environmental authorities. I think a starting point is potentially, and I would defer to also the other panelists because this is a little out of my expertise, but to start with the data. So what is the proportion of suicides? If suicides is an issue, if it's been reported that suicide is an issue, what is the proportion of suicides attributable, really critical starting point for advocacy to take to the Ministry of Health, to take to the Ministry of Agriculture and advocate for action to be taken. But I would also defer to my fellow panelists for their insights on this.
Does anyone else want to respond to that of the panelists before we move on?
I can respond to that, Andrea.
Debbie, go ahead.
It would basically be starting at the top, and I've got that in my presentation on how we dealt with it, is first to look at what is the amount of or the proportion of suicides related to your program, and then identify what the pesticides are that are being used for suicides, and then go through a elimination and substitution process of those pesticides that are being used for suicides, and eliminate them out of your process, because you can't keep using a pesticide that your staff or your farm workers are using for suicides. It's the precautionary principle. You can't. It falls under the category of unacceptable risks. You can't mitigate an unacceptable risk. So you have to take those pesticides out of your program. So you have to follow the precautionary principle, the hierarchy of control, eliminate, substitute, And then if you cannot find a safer alternative with regards to a pesticide, there are other ways that you can substitute and eliminate. And you can look at biopesticides, for instance, biological control agents, or even agroecology principles with regards to push-pull systems, also tillage, all sorts of systems. So you just have to look at a proper IPM system then. If you cannot put another pesticide in, replace another pesticide with a pesticide. And what I'll stop it there, yes.
Thanks. Yeah, we've got quite a lot of questions coming in. So I'm sure, Debbie, you'll have an opportunity when you get the mic again to respond to some other things. But Pumi, there's quite a few questions coming in about the guidance document, and I'm not sure if you're seeing them. So Mistral from South Africa has asked, how does the guidance compare the effectiveness of different regulatory approaches? So bans, restrictions, and safe storage in preventing suicides. Pumi, do you want to?
Yeah.
Yeah, come back. There you are.
Yeah. So the guidance document does provide specific case examples of the different approaches that are in the document. And you can, by reading those case examples, you can see the differences in the effectiveness. So for example, with phasing out acutely toxic, highly hazardous pesticides, it is very clear that this has had the most dramatic impact on suicide rates, as compared to, for example, safe storage, which, as I highlighted in the presentation, there was a very clear study that showed that it was not effective.
Thank you. The next question is from Jessica from South Africa. Considering the WHO FAO guidance and the need for accurate recording of pesticide-related data, can modeling techniques be used to improve regulation even with limited suicide by pesticide data?
Okay, so can you just repeat the question? Modeling technique, modeling of
Yeah,
which
so
data?
all the questions are in the chat as well, if
Okay.
it's easier for you to read them.
Yeah.
So the question
So,
is about whether one can model rather than having just actual cases. Could one model based on the data that is already available?
So to be honest, so a lot of the self-harm data, suicide data, intentional self-harm data from Africa is based on modeled estimates. And that's because the data is either unavailable or poor quality. So yes, theoretically, you could use modeled estimates.
Good, that's actually very helpful for countries to know. So the next question is from Sheridith from Guyana. So the guidance document's very detailed, concise, and it gives suggestions. The question is there a synergy between the chemical conventions and this document so that we are not duplicating efforts to properly manage HHPs and other dangerous chemicals? And would there be support funding given to countries who lack the resources to implement these important measures to save lives? It's a two-part question.
Yes, the first question, I'm very sorry, I cannot comment because the chemical conventions are outside of my scope of expertise. But if any of the other panelists can comment, I'm open for that. The second question, which is, would there be support given to countries who lack the resources to implement these important measures? Okay, so from, I assume that's asking from WHO support. From WHO level, there is not a specific fund that has been created, to my knowledge, to support this. Of course, we are always available to provide technical support to countries if and whenever it is requested. I can't comment on this because it is also outside my expertise, but there is a global alliance that has been established. And as I understand, there is a pool of funding that's being generated for this, but it's still very, very preliminary, early stages.
Thank you. And I'm going to call on Gamini, if you don't mind. I know you are in the audience. We have given you the mic. If you would like to respond to the first part of the question in terms of synergy with other chemical conventions. And I'm calling on you because of your work with the conventions.
Okay, thank you,
Gamini? Oh, there you are. Great.
Yeah.
And welcome.
Yeah. I mean, in fact, I was just trying to type my response in the chat, and thank you for giving me opportunity. It's much easier. Yes, of course, there are synergies. And when it comes to managing or regulating pesticides, it is not necessarily be in one silo. And the chemical conventions, I mean, if you take generally HHPs, the criteria for identifying HHPs, at least three, the three conventions are providing the basis for identifying HHPs, basically. So the things, the chemicals that are involved, included in these conventions are part of the HHPs. In some cases, they may not be acutely toxic, but still they are HHPs. So certainly, this is part of the bigger global convention or global efforts, and it comes through chemical conventions. Certainly, they are part of this whole thing, and there is a synergy a lot. And when it goes to the implementation at national level, this is something that I would like to sort of say something about it, that the chemical or pesticide regulators in respective countries always conform to the convention obligations, and therefore this is part of the management effort at national level as well as and at global level as well. Hope that helps and identifying this thing.
Thank you very much, Gamini. That's very helpful. And I think just to add to that, any document produced by WHO and FAO who work in the joint meeting of pesticide management would be quite clear about the conventions, and documents wouldn't negate, they would very much be in support. And you've made that very clear. Thank you. Bhumi, there's another question for you from Cindy. Who's asking if engineering interventions have actually worked to reduce pesticide suicides?
So
if you're aware.
In the guidance document, it states that in high-income countries, engineering controls are something that is applicable, but in low and middle-income countries, it's much more challenging to implement. And given pesticide self-poisoning is an issue that's more relevant in agricultural countries, low and middle-income countries, it hasn't necessarily been recommended as an intervention to prevent pesticide-related suicides in low and middle-income countries. So
there are several more questions, but we're running out of time. So I'm going to give you two quick questions, and then perhaps you can respond to the rest in the Q&A. So the first one is from Nkati Singh. Is the guideline friendly to implement in low and middle income countries? That the implementation advice is focused, implementation's advice is focused more on use of, I can't make sense of the second part, something about finances. Whether implementations are relying on a lot of financial resources.
So the guidance document was actually written with low and middle income countries in mind. The target audience were national authorities from low and middle income countries. And what you will see from reading the guidance document is that, as Andre mentioned, this hierarchy of controls, the most effective approach to reducing pesticide-related suicides is this phase out of acutely toxic highly hazardous pesticides that are used in pesticide self-poisoning cases. And what we know is that this is a very cost-effective intervention. There have been numerous studies published that demonstrate the cost-effectiveness of implementing such an intervention, particularly in countries where there is a high proportion of suicides related to pesticide self-poisoning. So in that regard, I think that yes, it is friendly to low and middle income countries, and cost-effective interventions have been recommended and advised.
So I think also in terms of implementation, it's really important that we then go on to our next question. So just to say, if you look at the screen, many people are indicating that HHPs are being used in their countries for suicide. And also there is a question about, how can we remove HHPs without evidence? But I think you quite clearly showed that we do have a lot of evidence, and you can respond to that a bit more in the chat if you like. So thank you very much. And I think we'll segue now into Debbie's part about how can we actually implement the document in countries, and particularly coming from South Africa. So thank you, Pumi, and over to you, Debbie.
Thank you. So I'm going to give a case study from DFFE, Department of Forestry, Fisheries and Environment in South Africa, how we dealt with implementing the guidance document on the use of pesticide regulations to prevent suicides. Next slide, please. Okay, so just to give everybody sort of put you in the picture, the DFFE is an EPWP, expanded public works program, which employs 35% youth. And now, as we all know, the largest bracket that are sort of succinct to, or falls within the category of high risk for suicides are the youth, and we employ 35% youth. So that's in our employment would be in the region of about 250,000 youth in the country. So DFFE amended our pesticide policy using the precautionary approach and the hierarchy of control to substitute and will first eliminate the highly hazardous pesticides and substitute with safer pesticides. And just looking at, we removed paraquat, which was used for burning fire breaks, warfarin, which was used for rat control, and aluminium phosphide, which was used for fumigation of our herbicide stores or pesticide stores. And there were many others. MSA was one for which was wholly or is completely used for the control of cacti. We were proud to say that we actually were able to get the chemical companies to assist us with the R&D for a safer alternative called Impala. And that was registered within 2 years, if I remember correctly. Then we did a full review of all the HHPs after we did the main ones. So the first ones we looked at was the ones that were causing the suicide, the suicides, which was the paraquat, warfarin, aluminium phosphide, and MSMA. And after that, we decided to do a full review of all the HHPs and then eliminate and substitute all of them for safer alternatives. Next slide, please. So after we did that, we embarked on a road show of awareness programs and toolbox talks. So our toolbox talks are done with the teams in field every morning before they start work. And the usual toolbox talks were around why you have to wear your PPE, where is the emergency exit, etc., etc. But we changed the toolbox talks to what is the impacts of suicides in the country, what is the risks of attempting suicide with the pesticide, etc., etc. So we got people in, mental health practitioners in to come and speak to the teams about the mental health issues around suicides, and also to talk to them about the impacts of HHPs regarding carcinogenicity, mutagenic and reproductive toxin, EDCs, etc., and linking that to why they should wear their PPE. But also at the same time, we were looking at engineering controls and behavioral controls. The engineering controls, we were speaking to the pesticide companies to ask them if it was possible to change the packaging of some of their pesticides. Like, for instance, the pesticides that were very, very effective on the invasive plants and invasive animals that were volatile. We were asking them if they could change the, excuse me, the formulations to make them sort of micro encapsulated, or put them in sort of like a sort of a capsule type formula, almost like those little capsules you buy that has your washing powder in it, that you just drop into your washing machine and they dissolve. That's the kind of sort of stuff that we were looking at to reduce and mitigate the risk of exposure to the people. So we tried all sorts of ways to mitigate risk. And then we went on awareness campaigns of container management and safe disposal, because we found that about 50% of the teams were reusing the containers. And that was a big problem as well. So we went on that campaign as well, and we started collecting containers. So if we gave a team 3 containers before we gave them the next batch of pesticides or herbicides, we wanted those 3 containers back. And then DFFE also conducts their own risk evaluations for this data. As this data is not available from the registrar, so we conduct sort of risk evaluation data on the pesticide and risk evaluation data on the suicide attempts. So we do whether they have what percentage suicide attempts we get a year, and what percentage suicides we get a year. And all our teams are linked to the National National Department of Health's the NMIC app, so that if they have a pesticide poisoning, they can immediately log it onto the app directly, so that there's no waiting period, so that they don't have to wait, and so we can shorten the period of being able to get them to get them logged on the system and get them the help they need as soon as possible. And then training sessions were held with contractors, staff, stakeholders to share the results on all the data that we collect, and that is done on an annual basis. Next slide, please. And I think that's the last one. Yes. Okay, thank you. You can open for questions now.
Fantastic, Debbie. Thank you very much. It's always good to have case studies, and really we are encouraging countries to use the guidance document, but as the questions were asking, how do we implement it? So there are a couple of questions in the chat. So several people have asked if you could share a link to download the documents that you're referring to. I'm not sure if that's a possibility.
Yes, sure. I will put the link in the chat box.
Okay, perfect. So there's a question on the topic of reusing containers, how to force the suppliers to take the containers back. That's from Analia. Do you want to respond to that?
Yes, because Department of Forestry, Fish and Environment has got a extended producer responsibility regulation in South Africa, which has got a section in that forces the pesticide company to take the containers back. So all we do is we phone the pesticide company and we tell them we have X amount of containers. Wherever they are, you need to go and collect them, please. So that's part of the EPR, the extended producer responsibility. And I urge everybody in South Africa who buys a pesticide from a pesticide company to call on the regulation, that extended producer responsibility regulation. I will also give you the link to where you can download the EPR regulation, because in that is where you have teeth now to get the pesticide companies to come and collect their empty containers.
And Debbie, does that refer to household pesticides as well? So if someone's just using a can of Doom, can they also, they shouldn't be throwing it in their municipal rubbish?
Yes, it refers to agricultural pesticides. And I checked the other day whether household pesticides are in as well, and yes, it refers to household pesticides as well.
That's most useful. Thank you. Thanks for that.
No problem.
And also, I liked the way that you described how, you were having discussions with the workers around various aspects with pesticides. And because of this guidance document, started including discussions around mental health and suicides using pesticides. So I thought that was a really good strategy. Have you had any feedback from the workers in relation to having received the information?
Yes, what we've seen over the last 2 years, we've had probably around a 30% reduction in suicide attempts, in let's call it successful suicides, we've had a 60% reduction.
Right. So I will jump in, and we earlier had a poll in terms of what terminology you should or shouldn't use when referring to suicide. So we've posted the answers in the chat. So it's encouraged that you say took their own life, or suicide attempt, or non-fatal attempt, or died by suicide, rather than successful suicide, unsuccessful, committed, commit suicides, or failed suicides. So it's also on us to think of the kind of terminology that we're using linked to suicide. There's a poll going on in terms of, have you heard or read about the guidance document before today? So there's a balance of only heard about it between, we have one person who's actually read it as well. Thank you for that. Let me just have a look at the time. Debbie, do you want to comment on anything that you're seeing on the poll?
Yes, I see that there's the no, they haven't seen it or read it is quite high. I do urge everybody to read it, because it helps you quite extensively with trying to put your strategy together on how you can implement a precautionary principle hierarchy of control with the substitution and elimination to get rid of your HHPs. Even if you just start with the suicide prevention HHPs. And then you can see how just removing the suicide pesticides, how it increases your success rate and your productivity in field. And then linking that to where you can then have mental health practitioners coming in and speaking to your people. And it's not just the beneficiaries, as we call them, the people that do the work in field, or your farm workers, but also your project managers, your area managers, and your sort of your directors, and the people with the money and the people that make the decisions, because it doesn't help just informing the people on the ground. It has to go all the way to the top, because remember, you need to get these policies approved. And so if you give, and I gave webinars to the management, and I gave several webinars to the management and to our stakeholders and to all sorts of people, just so that they knew what we were doing. And that's how we got buy-in. And so then it started spreading. So like our service providers at that time, municipalities, local government, etc., then started buying into the idea of our program, how we set it up. And then they started accepting the program and implementing similar programs in their programs. Like the City of Cape Town does the same thing that we do. The Western Cape government, I'm busy training the Western Cape government on the same principles now, because they want to implement that as well. So then it keeps growing. So you basically, you make the circle bigger. And then hopefully we can get to everybody implementing a suicide prevention HHP strategy.
Thanks for that, Debbie. Just to say, for people to look in the chat, there are quite a lot of resources that are being posted. So Gamini mentioned, and so did Pumi, I believe, the Center for Pesticide Suicide Prevention, which is based at the University of Edinburgh. And the link is to the website is in the chat. Pumi or Debbie, do you want to respond to the poll that's currently on the screen?
I would say, what is the most effective method for preventing pesticide suicide? Yes, banning the highly hazardous pesticides, but it's not just a one thing. So you need to connect it, because you can't just ban the highly hazardous pesticides. You also need to improve the mental health of the people, and you need to increase public awareness. And you need to increase the awareness of the decision makers, because they're the ones that are going to eventually give you the money to do what you need to do. So it's a multi-faceted approach. You can't just do one thing. Also improving the storage, yes, and reformulating pesticides. So for instance, like with the what did we want to reformulate? Oh, the triclopyrs that are volatile in temperatures above 25 degrees Celsius. So in like the Northern Cape, you can't use triclopyr. And what the people were also, people in the Northern Cape were using triclopyr for suicide attempts. So what we said to the pesticide companies is, can't you give us triclopyr, which works really well in a capsule formulation, a micro-encapsulated formulation, because then they can't use that to sort of throw in a container and let it volatilize, and then they breathe it in and off they go. And then they have to go to hospital. So and we got a lot of reformulated pesticides registered. So it's actually all of it. It's like all of the things except the not a problem in my country. But everything there fits together into a multifaceted approach. So you need to think about everything, but you can prioritize everything there depending on what the situation is in your country. But all of that was relevant.
Thanks for that, Debbie. Yeah, it's it's an important point to make that there's the hierarchy of control with banning and eliminating highly hazardous pesticides is important. However, it is important to have a multi-pronged approach. But removing the most hazardous is really a priority. So thanks for that. Pumi, did you want to comment? We have our last poll on the screen. And we just have a few minutes left. So if you could just click on the Menti link, then you can type in what challenges are faced in your country for monitoring and evaluating pesticide-related suicides. Pumi, over to you if you have any comments.
On this particular question?
On anything.
Okay. Just to reiterate that from the previous slide, it was actually really nice to see so many points for banning highly hazardous pesticides. I think that the message has gotten through according to the hierarchy of controls. Of course, the most effective intervention for reducing pesticide-related suicides is that phase out of acutely toxic pesticides. But as Debbie also highlighted, there's other approaches that are needed often simultaneously in order to get to the point of banning. Of course, we need to increase advocacy among the national authorities. We need to have the data in order to advocate. And some of those other strategies, it can sometimes be really challenging to reach the point of a national ban. So some of those other strategies like reformulating or even safe storage can be an intermediary step until we get to the point of phasing out completely highly hazardous pesticides.
Thanks for that. I'm just checking. There's a question, and really any of the three of you who want to respond to this is from Bruce. What can we do to reduce pesticide suicides in Africa? Well, I think you've just actually said that, but I don't know if you want to comment anymore.
So the question was, what can we do to reduce pesticide suicides in Africa?
I mean, I think you've touched on everything, but if there's anything else, then
I would just say that I mean, each country is different. It's hard to say what can we do it in Africa as a continent. Each country is different and has their own specific needs. For some African countries, actually pesticide self-poisoning may not be a common method. So I would encourage to look at data and for responses to be context specific.
Thanks. Yeah, I think that's a very important point. And I want to respond to some of the comments that are coming up on the poll. And often we indicate that funding is a problem for us in Africa and African countries, different countries, to be able to do various regulatory work related to pesticides. And one of them, so the poll here is referring to monitoring and evaluating. Poison information centers are important. Many countries don't have them. And then we talk about a lack of funding. However, in many of these countries, we're also not putting in financing systems domestically to actually have the industry pay for these things. So it shouldn't be the government looking for external funding to be able to pay for improving monitoring and evaluation. It should be through taxes, levies, EPRs, like Debbie mentioned, through those systems that the money then is used to support monitoring and evaluation. So just to think about that. I know that we have just 2 minutes left, so I'm going to ask Debbie, Cindy, and Pumi if anyone wants to respond to this last poll with 30-second input. Debbie, over to you for 30 seconds. Yep.
30 seconds, yes. We have EPR that will help us to force industry to give us the funding. So funding is not an issue. We have the facilities, we have the regulations, we have the acts, we have the everything. So all we need to do is we need to take the separate policies and regulations and enforce them. Because if we go and say we have an EPR, which forces the pesticide companies to assist us with the
Thank you.
extended producer responsibilities, there you go.
That's perfect. Thank you, Debbie. Thanks for that. And Cindy, I see you want to come in as well. Please come
just
in.
very briefly, there was a question about wouldn't raising public awareness cause curiosity rather than assist in reducing pesticide-related suicides? It's a good question, and it's something worth thinking about. But my sense is that it would be definitely better to advocate and inform the public of the kind of risks associated with pesticides. My sense is that it would reduce the suicide incident. Thank you.
Yeah, and I think what's key is we have found in countries that if you mention the product name, then you do get copycats. So if journalists and the media mention a product that was used for suicide, often you get copycats. So there is responsible reporting. But as you said, that doesn't mean that you shouldn't be raising information around it, as Debbie did, by bringing in mental health support and having discussions. So thank you very much for that point. So we've come to the end of a very dynamic and very important discussion. And I want to thank, first of all, the three speakers, so Phumi, Debbie, and Cindy, for giving of their time and really engaging all of us in different elements of this discussion and focusing around the guidance document. I hope many of you will be encouraged to use it. Thank you also to the participants for your questions, for thinking about this, for sharing your thoughts and comments. We appreciate that. That's what makes the community of practice dynamic. Thank you to Natasha and Janice in the background for helping to make this an interactive discussion. I'd like to encourage you to join our next discussion, which will be on the 24th of October. We will be discussing another guidance document, which is coming out from FAO and WHO, looking at phasing out highly hazardous pesticides. So what's the implication if you have a phase out period and you allow countries still to have 2-3 years to use a product before they actually get rid of it? So we'll have a discussion on that, and I hope many of you will join. Also, just to let you know that we've been advertising 2 academic programs. So there's the Masters in Chemicals Risk Management. Although the deadline has passed, we have 5 places with some limited funding, so we encourage you to apply. And also the Masters of Public Health, which is so the Chemicals Masters is solely online, and the Master of Public Health is face-to-face. And just to say that there will be a digest coming out from this discussion, so please make sure you've signed up to the community of practice, and you will receive then the links to the slides. I know many of you want the slides, and we will make sure that you get those. So thank you again to everyone, and I wish you a good day wherever you are, and let's keep up the good work on trying to prevent pesticide-related suicides. Bye for now.